All right, welcome everybody to October office hours. Can everybody hear me okay?
Yep.
Great. And then you see the slide deck and the chat function, all right, hopefully?
Yes on the slide deck. Technical
Good.
difficulties, yes. And yes on the chat.
All right, thank you. So we're in business. All right, so we are going to get started. We're a couple minutes after now. We'll get going. We got good mass here for joining, so thank you for joining office hours. We're recording as usual, so folks will have a chance to get this on the website in the near future for future reference if they'd like. And as always, if you have questions along the way, feel free to jump on and ask. If not, the chat function is there for your availability as well. And with that, we will get started. Normally, we got our policy procedure updates. This month, we shifted our process a little bit based on some feedback we've gotten. We moved our children's updates a little bit further down in our agenda. So we've got quality management performance items are going to be more up towards the top with some compliance updates as well. We're going to touch on our health home redesignation results. Then children's updates. Want to talk a little about the Healthy Alliance SCN, the social care network, just a little bit on that topic, and then a little bit on our health home service agreements for the network. Just some updates coming on that. That's going to be coming forth in the new year. So that's what we have for the agenda for this month. And with that, I'm going to kick it over to Jessica quickly.
Hi, everybody. For today, we don't have any policy and procedure to go over. We do have quite a few upcoming. Some of those upcoming policy are our CANS policy, Plan to Care Adults, Core Service and Billing for Children, HCBS disenrollment and system access. However, we do have quite a few that are in the hopper for updates, so we're probably going to spread those out a couple of months so we're not overloading you guys in 1 month with policy. So hopefully we see these in the next round of office hours. But that's it for policy updates right now. And if you guys have any questions, as usual, you can always reach out to myself or reach out to the Health Home email if you guys have any questions on policy. All right, Health Home Plus, we did send out a reminder via email, just a little bit of extra communication around the Health Home Plus groups that we have. So I just wanted to touch base on a few things because as we work through those audits that you see in your quality notebooks, we are continuing to see a little bit of a theme. So we just wanted to send out a reminder. So we did that via email, and then we're just going to discuss it quick today and then open the floor for questions. First thing, that anybody who's being enrolled in Health Home Plus SMI population, they have to have a specific list. They have to have a specific diagnosis from that list of diagnoses that are in the eligibility policy. It is a very prescribed list of F codes that the member has to have in order for us to bill SMI. So it's not any mental health condition. It has to be a very specific diagnosis that is on that list. So if you guys have any questions at any time, whether someone is eligible or uneligible because of the SMI, you can always feel free to reach out to the health home and we can help you determine that. But we just really want to be super clear that we do check that diagnosis to see what you're billing for and that the member has it. The other thing that we wanted to touch on is that it's super important that you are selecting the appropriate category for billing. So that question 12, you have to select yes that they're Health Home Plus and that category. It is extremely important that that category be correct that you are billing for and that you have documentation to support that category. We can now verify via our OMIG audit that we're going through that if your eligibility does not match and have a date on it, I almost said timestamp, but a date showing us the date that made them eligible via your supporting documentation, it will be questioned by OMIG. So the person could be eligible for Health Home Plus and you select accidentally the wrong category and upload something else. They will say that those two things do not match. So it's super, super, super important that that all matches. The other thing that's super important to remember is that once a person becomes eligible for Health Home Plus for SMI or for HIV, you do not change that billing category. So if you say that they are eligible for Health Home Plus for criminal justice and you bill for them criminal justice for October, you cannot change it to homelessness in November. It has to stay the same all 12 months that you're billing. Now, if you get to the end of that 12 months and the person re-qualifies for Health Home Plus, let's say under a different category, then it would be appropriate to change the category, but that would be the only instance when you would want to change that category. So when it comes to Health Home Plus billing, we always want to make sure that all of these things are matching in the HML, eligibility, and then our supporting documentation. And then we also, with one of our CMAs, we just put a quick deck together to review Health Home Plus. So if you guys would like that at any time, we can absolutely do something for the whole network, or we can come out individually to your CMA, probably take 20-30 minutes just to kind of do a little pulse check on that Health Home Plus. But does anybody have any questions on this or anything else pertaining to Health Home Plus billing? All right, well, if you guys have any questions at any time, please feel free to reach out to myself, Taylor, or to the Health Home general inbox for any questions. And then, like I said, we do have a quick 20-30 minute slide deck that we could walk through with the network if you guys would like that, or individually with your CMAs. So you can go to the next slide. All right, and Taylor is going to touch on the CES tool.
We have one come through, Jess.
Oh, okay. I have a client enrolled this year who was eligible for Health Home Plus due to multiple medical hospitalizations. Diagnosed that once we started working together, she could not meet after a year. Is that okay? Okay. So Amy, that's a very good question. So we deem people Health Home Plus based off of their diagnosis and then whatever utilization category that they meet. If we have a member that we're serving that cannot meet with us or refuses to meet with us or refuses to participate at that level, we completely understand. I would not take them off of Health Home Plus. I would continue to answer question 12, yes, and 12A, no, because you're technically keeping them in Health Home Plus. So what OMH is looking for when we're audited, because when we get audited, Travis will touch on this later. We have the AIDS Institute comes in, there's DOH representation, there's OMH representation, and OMH will specifically look at these records. They're looking to see if we're identifying and serving that member. So Amy, as long as you are identifying that member and attempting to serve that member and telling the story in the notes that you're attempting to meet with this person, but they're either not compliant or they cancel, that is okay from a quality perspective. The one thing I will tell you is that they will continue to appear on your quality notebook, whether or not you answer those questions in your HML. So they will continue to account in your utilization in towards that 50% threshold. So even though they're not meeting with you, I would still keep them in. Any other questions?
Oh, something else came in.
Specific SMI need to be the primary for, yes, so the primary problem should all align. So you will see some charts that it does not align. So yes, when you go to update the comprehensive assessment or the plan of care, and you can easily change that primary problem, I would absolutely do that because we're looking for the golden thread of documentation. We want to make sure everything lines up. So yes, it should absolutely be an SMI eligible condition as the primary problem in what you're billing for. I would not rush to update everyone's care plans and do that all right now. I would just do it through your natural course of work, make sure all of that is updated. Acceptable proof of supporting documentation. Yep. So we actually, Andrea, did that on our office hours. I believe it was in June, but I
Yep,
very
I think so.
much could be wrong, and that is recorded. So you can go reference June's office hours that are recorded, but we literally walk through everything that would be appropriate for supporting documentation. And Andrea, if anybody at Alliance would like to have just a one-off 20-minute little presentation on Health Home Plus, we can absolutely walk through that as well. So it gives you the opportunity to ask questions.
All right, thank you all for the great questions. Feel free to keep popping them in the chat too if you have them, and we can circle back. I'm just going to touch on a brief functionality update to NetSmart regarding the CES tool. So it did come to our attention that care managers were able to void CES tools in NetSmart. We have since turned off that functionality for care managers. So only a supervisor at this point is able to void and finalize a tool. And of course, if you run into any trouble, you can always reach out to the health home, and we're happy to assist with that as well. But care managers no longer have the functionality to void them themselves. This was causing some issues with billing and multiple dates being sent to MAP when CES tools are voided. So if you ever have any questions, just please feel free to reach out, and we can make sure that things are triggering and pulling directly and appropriately to MAP to make sure that all billing will go through appropriately.
And Taylor, I just want to clarify that this is DOH and Health Home Policy. So this is derived from DOH policy, that supervisors should be finalizing the CES tool, not care management staff. So it's something that's coming, that's the root of policy from DOH, just so folks know.
Thanks, Travis. I think you can go to the next slide.
Oh, sorry.
That's okay. All right, so just to touch on our follow-up process for comprehensive chart audits. So we're through about, I don't know, probably 90% of our chart audits for the year of 2024. So for some of you, this won't apply until next year, but I just wanted to kind of do a brief overview of our follow-up process because we have had some kind of stickiness throughout the process. So we will be aligning this in policy and sending it out to you guys in the near future, but I just kind of wanted to touch on it today for those CMAs that have yet to undergo the comprehensive chart audit in 2024. And then for those of you, when you undergo it in 2025, you'll have this in the back of your head. So just a brief overview of our process. So the start of the process for you guys is that you'll receive your audit results with your quality notebook for whatever month after you're audited. So you'll get your results in 3 different ways. The first of which is it's going to be laid out in the quality notebook. So you guys will notice that you have a comprehensive chart audit tab in your quality notebook if your CMA is getting your results that month. If you are not getting results that month, it's hidden, you won't see it. But if you do have them there, you'll be able to click on that tab and you'll be able to see a little overview of your results with the SIN numbers, the care manager that was assigned to that chart, as well as the score, and then the overall average score for both children and adults. If you serve both populations, you'll see both broken down into 2 separate categories. You'll also see some generalized themes for any, major deficiencies that we saw over and over again on charts, just to kind of lay those out for you guys as supervisors, so those can be points of discussion with your care managers. You'll also get the results in a scoring tool, so that will come through in an Excel document. You'll have a summary page in which you'll see all of the results tallied there with your overall scores, and you'll have any areas of deficiency that have been identified highlighted there as well. And then about halfway through this year, I started putting individualized sheets for each SIN that was audited on that scoring tool. So along the bottom of the Excel sheet, when you receive it, you'll have one tab for each SIN that was audited. And you'll be able to see the SIN number, the status the member was in, and then you'll see any of the questions that you are marked off on for that particular chart. And then any that can be resolved will be highlighted, and it will have a yes in the requires resolution column, and it'll provide you a date for resolution. So of course, there are some items on your chart audits that won't need to be resolved. You know, if the member is discharged, or maybe it's an item that has since passed and you can no longer resolve it, those will be marked as, you know, NA, or they'll be marked as something to resolve moving forward. Anything that's marked with a yes and a date will need to be resolved prior to that date. And then the last way you'll receive your results is your actual hard copy audit sheets. So those will be sent in a zip folder along with the quality notebook and the scoring tool. And those will be kind of the in-depth, you know, audits that we actually mark on. We mark them up. There's lots of notes on there, and you can refer to any notes for reasoning behind why points were marked off on those particular questions. So after you guys receive those results, we really encourage the CMAs to take a deep dive into the audits and go through our audit refute process. So it's kind of up to you guys at the CMA level how you want to do that. Some folks do it, just the supervisors take a look. Some people pass it along to the care managers to take a look at their individual chart audit results. That is entirely up to this individual CMA, but we highly encourage you guys to take a deep dive into the questions that you got wrong. It really helps, you know, understanding of policy, and we definitely want to give points back if points are warranted for you guys. So we will be issuing a new form that we've come up with. I will send them out with the chart audits when your CMA undergoes the chart audit process. You guys will be able to fill out any questions that you would like to refute, and those will be due at least 1 week prior to our scheduled meeting between the CMA and the health home. We'll also ask that the CMA resolves any applicable deficiencies in a timely manner. Again, this is laid out in the scoring tool for you guys, and there will be a date provided for resolution. Of course, we know that all of these things may not be able to be, you know, resolved in the timeline that's laid out, just due to, you know, us working with members, and we may not be able to get a hold of them in that time frame, and so on and so forth. So if more time is needed, we're more than happy to provide it, but please communicate that to the health home. That way we can note that for our records. Next slide, Travis. Follow-up process continued. So about a week after I send out those results, I'll reach out to the supervisors at the CMA to schedule a meeting with the supervisors to go over the results. We do ask that you send back that audit refute form with any of your audit refutes and resolve those applicable deficiencies at least a week before our audit review meeting. That way we have a chance to deep dive into any of the refutes that you guys have and award points back where needed, and just come up with talking points for our meeting. That way we can let you guys know if, why, or why not we're able to provide points back to you guys at that time. Again, we will meet to discuss the results of the audit and can provide you feedback on those refutes and award points back as warranted. At that meeting, any CMA that has scored below an 85% will go on a corrective action plan. This is totally meant to be a supportive process. It's not punitive in nature at all. We just kind of outline any of the overall themes and deficiencies that we've noticed throughout your chart audits and come up with a game plan for resolution. And like I said before, we will be updating our policy to more clearly define this process, but I just wanted to give you guys kind of an update and go over this process for follow-up on today's office hours. Does anybody have any questions? Okay, thanks, Travis. I'll turn it back to you.
All right, Taylor, thank you so much. So Taylor just went through that process, and the results of that process are showing right here. We just got done with our redesignation. Our health home, as a result of all of your hard work, received a 3-year redesignation. So congratulations, everyone. Very, very excited about it. We are a 91% score for our network. For our adult program. So you can see on the right-hand side, that's a tier 2. And that's the preliminary results. So we're going through a review process right now, actually, as a lead health home. So what Taylor just described to you all that we are outlining for our network, we're actually going through as a lead and reviewing charts and trying to refute to raise our score to try and get it higher. Going through that process right now. So we had, to put in perspective, we had an 80% 2.5 years ago. So if you look at this new process right now, if we scored an 80% today, we would be a level 4, which would put us where? A 1-year provisional. So that's why we have a 85% threshold. We want to have ourselves well away from anything that says provisional. So that's why we have that standard as a lead. And that's why we're trying to do this as a supportive partnership with all of you. And I know in the past we didn't have such stringent standards, and we put them more in place over the last 1.5 years, and it's gotten a little bit more tougher. But the DOH policy and standards have gotten a lot tougher in the last couple of years, and we've been trying to build this process in a supportive way as a lead, as the state's been pushing it down our throats. And I hope, even though it's been a lot, that we've been supportive and partnering with you all in a way that's been malleable for the most part, I hope. I hope as we move forward that it shows that we're continuing to be partnering and supportive in our approach with you. But that 80% that we got 2 years ago, 2.5 years ago, we would be a provisional status. So what that would mean right now, if we got that again, we would have weekly meetings with the Department of Health. Our status as a lead health home would be in jeopardy, which means your provider status with us as a lead would be in question to be able to continue as a care management agency under AHI Health Home to provide care management services. So that would all be shaky grounds for services for care management. So we're very excited that we're not in that area any longer, and the standards are much different and much higher and so carrying on, very excited about that. So congratulations, nice job, everybody. Couldn't do it without you. And we're really excited about this. So awesome. So the domains, how was it done? I think I've mentioned to it in the past. The first domain was we had to report out on all of our quality program and compliance program work. What do we have in place for training and quality and compliance? So we had to put all that forward. We had to send all of our trainings that we do. We had to put forward like all of our office hours type stuff. We sent our website, all the trainings we did for the network, all the recordings around those trainings, all the stuff that, Jessica's done and Taylor's done for the network, in person, virtually, things that we've provided, onboarding type trainings, all that type of stuff. We had to show proof that we've provided that in the last couple of years. And we had to make sure that was there. And we had to show the proof of that. We had to show that we had a compliance program. We had to show that we had a quality performance committee and that we had minutes for that and that we have that in place. We had to show that all that stuff's documented. So we did that and we got 100% on all that. Our quality notebook, the DataDen platform. We showed a demonstration on our DataDen platform, the non-PHI version. We showed that we have that in place. And the Department of Health and Office for Mental Health and HIV/AIDS Institute all really thought that we had 100% of that in place. So that can't get better than 100, right? So we're really excited for that. So that was really cool. So that was domain 1. Domain 2 was our process measures. The comments we got back, we performed strongly in 5 quality measure areas, and we exceeded the threshold for 4 of the process measures. So you'll see quality measures 1 out of 10 on the right. Those are the things that are the gaps in care that the leads are reported on this was the year of 2021, which was selected for our health home, which was for the state actually. They chose 2021 for the redesignation period for lead health homes. These were the gaps in care that they looked at, and this is how we performed for 2021. And then process measured follow-up right under the slide on the left on the bottom. That's how we performed. So we did pretty well there. We were told, even though we got a 75 weighted, we were told we performed as one of the strongest in the state as a lead, which I thought was interesting because we didn't think we did that well. But they said that we performed one of the strongest. And what were we doing to get such good results? And we said we did. Our organizations just did constant traditional follow-up with their folks. We didn't really have any method to our madness beyond that because we don't have a lot of great resources in this region because there's not a lot of resources. There's, it's just a lot of providers trying to collaborate and work together. And it's just a lot of follow-up. So great work done there. 2021, this is what the results were from that. And then domain 3, these were the 50 charts that were pulled across the network from the CMAs. We scored a 93% weighted. They said we had the golden thread across the network. So unweighted, we were 95.78% for our plans of care chart reviews. Now there were themes. So this is where we're going through our process of trying to get our score higher. The comprehensive assessment, there was a lot of areas that were incomplete, not completed, and that was a trend. So we have to go through and we've got to improve in those areas. We've got to have completed comp assessments. We can't leave sections incomplete. That was a deficiency area. Another area is linkage to providers. There was a lot of gaps that they were seeing as they were looking at care plans and service linkage. So those were two themes that did stand out when they did their preliminary review for the audit results. So we do have some areas of improvement in those two areas. But what an outstanding, I almost fell off my seat when we got this back because chart audits, that's like the Achilles heel anywhere, right? You never know. Depending on what charts, when and where they're pulled, you never know what you're going to get. But to get the golden thread, that was phenomenal. So congratulations. What awesome work. Just phenomenal. Phenomenal job, everybody. Couldn't believe it. Just phenomenal. I'm just going to pause for a second. I don't know if anybody else had anything they wanted to mention or say, but this was just great. Thank you. Right. The other thing I wanted to share for transparency's sake, so 61% of our supervisors, I was telling you the survey went out to the CMA supervisors on how they felt the health home performed. So I wanted, for transparency's sake, to give you all what that feedback was. Now, obviously, it's anonymous, but here's what the feedback was. So 61%. So, that's a pretty good response rate across the network. But, communication wise, you got it right in front of you, how we fared for communication. Obviously, we always have room for improvement. But overall, there was feeling that the communication was decent. It was pretty good. Sometimes questions go unanswered. We could be a little more timely at times, but overall satisfaction was there. Updates communication wise, they felt that there was point of contact for communication updates was fairly timely as well. When there was updates statewide. we're pretty good about getting that out to the network when those changes came up. Pretty responsive on that typically. This was the feedback for that. When there's a question to the health home, how long does it take to give it a response? General sense was within a day. About 42% said it was within 2 to 5 business days. Depends on who you get. Some folks said. Some people were quicker than others to get back to. We always say try to use the health home email box because, depending on who's working, some people are easier to get a hold of than others. So some people will be faster to get back to than others, depending on who you're trying to get a hold of. So that's why we try to say the health home email box because that's manned by a person. But again, there's always room for improvement there for sure. Procedural changes, do we communicate? Policy wise, how do we do there? The network felt that we got within 30 days that we got that stuff out to the network pretty good. What do you think about the EHR? People thought it was okay. It was good. User friendly is all right. The Rio, it was okay. The Rio was good. Satisfaction with training. There were some conflicting messages on the training, like, modality was something that came up, training offerings, but then in the next question, how many, types of trainings were provided? There's a whole different slew of trainings that were mentioned that were offered. So, so clearly there was some conflicting input that was put there. But again, we're always open to more feedback on that. We always want to improve in that area. So if there's ever any trainings that you want to see that you're not seeing yet, please let us know. If there's a certain modality that you like to have that you don't have currently, let us know. We're more than happy to look at that and offer that. But satisfaction wise, it looks like generally people are satisfied. Audits. Um, here's what folks feel about that. There's a question about particular staffing turnover, just so folks get an idea, like over the network, what the turnovers look like. Billing, billing payments in a timely manner, um, and then overall satisfaction for the health home. So that was feedback from the network. So in a general sense, there was decent feedback. People felt that we were doing a decent job, and again, always room for improvement. So please give us any thoughts you have moving forward that you'd like to see for improvement, and we're open ears to hear it, and we look forward to it. So thank you all again for everything you do, and congratulations on the redesignation on the adult program. Children's were due in the spring. It probably won't happen right then because they're all behind on that stuff right now, but we're doing the spring for children. It's supposed to be in May. Any questions before, or any comments before we switch over to children's updates? All right, well, big congratulations again. Thank you all. All right, Jess.
All right. Yes, let's move into some more changes that we're communicating. Um, big change on the children's side, that core services policy, that billing policy update. It will be live and effective for 12/1. We have had yet another update to the DOH policy, so I have not released a final version of our policy. Hopefully that'll be happening in the next 30 days. There's one modification I have to make right now. Then there's also a meeting that's happening on Thursday that I am going to try and call into from vacation. If not, Taylor has so graciously offered to sit on that call and take notes for me to see what information we can pull from that meeting to get a final policy out to you guys. But for right now, you do have that draft policy that I had sent out for comment. There's just some tweaks to it. Overall, it is pretty similar, so it shouldn't be anything shocking. Given that it's a pretty significant change in how we work and bill for children, I'm going to be hosting, I don't want to call it a webinar and I don't want to call it a training. So we're going to call it a policy overview on November 15th at 1 p.m. Just kind of walk through some of the policy a little bit. Hopefully you guys will have a finalized version of it so you guys can really go through it and come prepared with your questions. We'll probably, if we have a lot of questions, do an FAQ to follow that up. But I did think that this is such a significant change on this one policy affecting only children that doing something special just for the kids group would be the best choice. And if you can't make it, that's perfectly okay. Just let me know and I can set something individual up with your CMA, or I can offer a second time if needed. I am hesitant to record this because if you know anything about DOH, nothing stays the same and everything changes. And I foresee changes happening once this actually goes live and we're actually starting to do it. So I don't want to record it because I don't want that kind of permanently living out there. Does anybody have any questions on this in particular? All right, you can go to the next slide. All right, one update, I put together an HCBS goal sample sheet. So we've developed kind of a description sheet for each kind of service and some example objectives and interventions that you can refer to when you help to develop those HCBS plans of care. So what we've been noticing month over month when we audit our HCBS plans of care, that they have to have goals, objectives, and interventions in there that pertain to the service. And really across the board, care managers are really kind of struggling to like nail down what we should be putting in those sections. It's not terribly consistent. Also, there was supposed to be forthcoming some tip sheets for parents and handouts to help support the conversations on the services. Those have yet to come from the Department of Health. So a couple of my internal care managers were super, super helpful and helped me put together this goal sample sheet. I kind of put it together. They helped me with the objectives and interventions because they're the ones that are actually writing these. So I just want to shout out Donna and Laurel and May for my internal team for really developing this goal sample sheet. So I am going to include it in your HCBS toolkit. So I'll update that and I'll be resending that out and that'll be in there. And that will really help support writing those HCBS plans of care. Upcoming updates to IRAMS on Monday. As you all know from the webinar that we had, the HCBS authorization forms are live in IRAM. So moving forward, when you get a frequency, scope, and duration for your service or services, that form is no longer a paper form coming back to you. That form will be uploaded into oh my gosh, I almost just said NetSmart. It'll be uploaded into IRAMS and you'll get notification of that just like you get IRAMS notifications right now and updates on your referrals. So that will be moving into that system as of the 21st, so Monday. So if anybody, any provider sends you a paper version of the HCBS Health Home Care Management authorization form, you are to decline it, loop me in, because we need to get that into IRAMS for it to be acceptable and appropriate. Does anybody have any questions on those two items that pertain to HCBS? All right, so lastly, what I have is just a quick little update on the UAS. As I've been discussing, there's going to be changes on how we certify for our CANs, and there's going to be a change where you have to have an HCBS LOC certification. Those are being added. We are working through the process on that because the original timeline was now, but we have asked that that be pushed back, especially with the new policy coming out in 12.1. It's just a lot all at once. So I do not have anything in writing. It's really kind of still in the development phase as to what we're going to land on with our feedback. But what they're looking at is for new care managers, so newly onboarded care managers that are going to be serving children. They are looking at a 2 half-day, I'm going to quote unquote, live intro training is what they're calling it. It will be 2 half-days that they sit through that. Then they will be able to take their certification within 30 days of completing those 2 live trainings. And for everyone who is currently certified and moving towards getting your annual certification, what they are going to do is it's going to be a half-day, quote unquote, live booster training, and then you will take your certification. They are talking about putting this in the UAS as recommended as soon as next month. Again, that is not written in stone. That's why I don't want to put it on paper anywhere, but they're saying it's going to be potentially in the UAS as recommended, and then go to being required in 2025. A couple of dates have been thrown out. Personally, from our perspective, AHI has suggested back to them that we push it until the end of March of 2025. I don't know if we'll see that, but that was my personal recommendation on that. So you will also have to certify 0 to 5 and 6 to 21. It'll be 1 certification with 2 vignettes. So everyone's going to be 0 to 5, 6 to 21 certified. Right now, you don't have to be. Future state, you will be, and there is no option to just certify for 1 age group. So more to come on that. Hopefully in November's office hours, I do have more concrete information for you, especially because they're saying this is going to go into the UAS soon as recommended. We typically don't have office hours in December, so if for whatever reason is pushed back, please look out for email communication from me explaining all of this and the changes. And then for the HCBS level of care certification, that is going to also be in the UAS. So anybody who completes an LOC certification for any of our youth enrolled in HCBS, you will have to walk through the modules on that. It should not take very long. It kind of just goes through the required components of the LOC. You walk through that and then you get your certification. We are looking again to roll that out as recommended and then it to become required. They're going to move forward with the CAN stuff first and then push out the LOC. It's not going to be all at once, but the time frame will kind of be close together. Also, they will not make a determination at this point. When I say they, I'm talking about the Department of Health on whether that's going to be required one time or an annual training. They're looking actually to see what I'm thinking, looking to see how people perform on that HCBS certification first before if they determine that that's required. And that will not take the place of any trainings that I do regarding HCBS because it's a small supplemental training that they're doing in the UAS versus the more comprehensive training that we walk through. But again, if any of this gets pushed out outside of office hours, I will absolutely send out email communication on that. Does anybody have any questions on UAS updates? All right. Well, if you think of anything, please feel free to reach out.
Thank you, Jess. So I wanted to touch on a slide to let folks know. I know a lot of folks have made aware, some may not be, but most probably have at this point, that Healthy Alliance is the social care network entity for the North Country region. I put the slide up just so folks know the contact information. So Scott Emery is the Chief Strategy Officer. The information to connect with him is info@healthyalliance.org. So the regions they have, North Country region and Capital District and Central. And if you need to reach out to him, if you're interested in being a CBO within the SCN network, or if you want to find out more information about the SCN, I just want to have this information there for you to be able to reach out there. Also, I just want to make the awareness. So we as a lead health home and as AHI are going to be in more communication. We actually have been, our CEO, Karen Ashline, has been talking with Erica Coletti, who is the executive director for Healthy Alliance. AHI is in partnership discussions with Healthy Alliance around the SCN work. That lead health home is actually currently filling out an application to contract with the SCN as a lead health home. So, we're in the throes of doing that work right now, currently as a lead health home. So we will be contracting with the SCN. But I also wanted to, just for purposes, make you all aware that there will be points that the SCN, whether it's Scott or another person from the SCN, will be coming on office hours from time to time just to talk about the SCN work and what's going on with the SCN, just to inform this network. So I just want to give folks a heads up that that'll happen from time to time. Just, more for awareness, because that is going to affect our work as a health home and as far as screenings and, enrollments and whatnot and work for Medicaid recipients out there once that's up and running. So just more of an awareness. There'll be more to come as we know more. The manual version 2 is supposed to be coming out shortly, this week, if not already or very soon. That's going to give more details on what all the rules and regulations around the SCN rollout's going to be. So we'll know more around the health home and how that's going to apply to that work, and what we can and cannot do around the billing and all the work around the SCN. So more to come with all of that. I know there's been a lot of bated breath around that and how that's going to apply to the health home world. So we're still waiting to see how that all unfolds. But I just wanted to get this information up for folks as folks are up there. But the North Country region, as far as it applies to our health home lead, does not include Saratoga County. So that just carves out Saratoga County for our lead itself. So when we applied as a lead SCN for our health home, Saratoga County, we're going to have to apply Saratoga County for the Capital District. So we'll be actually doing 2 applications as a lead health home, one for Capital District and one for the North Country, because Saratoga's got to get carved out in that respect. But I just wanted to pause quick if there's any questions particular to what I mentioned around this. And then you have this contact information for folks if they have any questions to look into it more. So more to come. So we'll have a visitor in the near future, I'm sure, to talk more about it from Healthy Alliance. So our health home administrative services agreement and our BAA contract. So each CMA has one of these with the lead health home. We're going to be doing updates effective new year. I wanted to announce it today to give our supervisors time to let your contract administrators know within your organization. There'll be a memorandum that'll be sent out via email and hard copy in the mail at the beginning of November. So I wanted to get it out verbally now follow up with an email and a hard copy the beginning of November. And then shortly thereafter, the actual contracts will go out in November, likely by the middle of November. There's going to be an increase from 6% admin fee that's in the contract now that the Lead Health Home charges to 7.5. So we're going to be increasing our admin fee from 6% to 7.5% for our admin fee. And it's going to be an increase. We haven't changed this since 2020. It was July of 2020, the last time we did an increase in our admin fee. So it's been quite a bit of time. Number of reasons go behind that. There's a lot of work that's done on our billing end as far as claim adjustments and processing for voids and adjustments, correct rates applied to that, etc. But those are just a couple things. But we also have done a lot around our data den work, which was not in place back then. It's something that the Leads put in place and offers to the network as a nice quality tool for folks. And we've done a lot around our Health Home webpage and our quality in general to support the network and put tools in place to help support you do your work so that we can all be successful. So, we're really feeling that this helps to support and justify this adjustment to the contract. So we're going to be moving forward with this. So I just wanted to give folks this notification that this will be coming. So that will be happening. So there'll be more notification on this in the near future. So just a heads up that is happening. If there's any questions at the moment on it before I moved on. Okay. And then I had a quick announcement. I'm going to be setting up a special office hours. We're going to have a November office hours that'll go out as usual. But prior to that office hours, I'm going to be setting up a November 18th special office hours for 1 o'clock. We have Ascend Mental Wellness is looking to do a presentation on their SPOA process and application, as well as different types of residential services that they offer and other services as well for Warren and Washington counties. And the residential services directors are interested in presenting, and they approached, and I'm more than excited to have them do that for our network and for those that are interested. So I want to offer it to our whole network. I know we have a lot of folks that are not Warren and Washington counties, but I'm going to put it out there for anybody who's interested in learning more about Ascend. So I'm going to set it up for November 18th at 1 o'clock. It's a Monday. I'll send that invite out before the end of this week to the network. And anybody who would like to join is more than welcome to do so. So look for that invite and we'll get that out there. And Taylor, you wanted to mention something about the quality notebooks?
Yes, I just wanted to mention to folks that I will be out of the office for the first couple of weeks of November. So there will be a slight delay in your November quality notebooks. They will likely be sent out to you on the third Friday instead of the second Friday of November. Just wanted you guys to know so you didn't get worried that I forgot about you. I promise you'll get them.
Okay. And that was all we had, unless anybody had anything else they wanted to talk about. As always, thank you for everything you do. And congratulations again on the adult redesignation. Have a great rest of your day, everyone. Take care.